everyone, I'm Dr. Ganeshwari Raika. Welcome back to my channel Newbie Doctor, where we make clinical medicine easy. So today's topic is going to be ABG and we're going to make it easy. Okay, that joke didn't land. Let's get on to our case. So today we're going to have a 60-year-old man who comes into the emergency department complaining of shortness of breath. Somehow shortness of breath is a common symptom. His vitals are taken. He has a fever of 100 degrees Fahrenheit, for which we've started him on paracetamol. He has a higher respiratory rate of around 20. His BP is 160/80 and his heart rate is 100 beats per minute. Now his saturations, which are the ones that we are concerned of, is 86, which is not good as well, right? Now his ABG shows hypercapnia. What is the most likely direction in which the other values of your ABG will go? So this is a very typical case that occurs, this is a very typical question that sort of comes in a lot of competitive exams all around the world, and it assesses how will you understand if, supposing you are sitting here and you're the doctor and someone says the ABG shows hypercapnia, doctor, and you're supposed to understand that and anticipate how will the ABG look or predict how the ABG looks, right? And accordingly you can perhaps take measures without seeing the ABG, perhaps, if not first hand, but if, of course, every time see the ABG, but it helps you understand the problem and put in steps. The first question is, what is hypercapnia? Hypercapnia is nothing but increased carbon dioxide beyond normal range. Now our range of carbon dioxide is 35 to 45. We have a very short range of normal carbon dioxide, and when it crosses that range, usually we call it hypercapnia. Now hypercapnia also means another situation, as we had addressed this in our first case. Whenever linked with shortness of breath, we have to think of respiratory failure. When there is hypercapnia, it is respiratory failure type 2. So we have two problems here. One is respiratory failure, and the second is our disorder, which I was just going to mention. However, let's decode the problem here. So we know that carbon dioxide, right, if it's high in the blood, it will convert to carbonic acid. So carbon dioxide increases again the acid content of our blood. Now when the acid increases, the first thing that comes to neutralize the acid immediately, like the pawns of a chessboard, are bicarb. Bicarb immediately tries to neutralize the acid. What happens is your bicarb, as a result of neutralizing, will drop. Back to our steps. The first step is to figure out our pH. The second step is to think of bicarbonate, and the third step is to think of carbon dioxide. But here we're going to reverse the story. We know what the carbon dioxide is, right? So we are going to first address that. We know carbon dioxide is high, and that's going to be step number 3. Now step number 2 is bicarb. To compensate for carbon dioxide, you're going to have very, very low bicarb, right? So the bicarb is going to go down. And finally, we have the pH. Because of high carbon dioxide, we're going to have high acid, which would mean the pH is going to drop, right? So the primary problem over here is respiratory acidosis, right? Now a key thing to remember here is anyone who has respiratory failure type 2 invariably has respiratory acidosis, or vice versa. Okay, therefore it's important to tackle both. Pro tip here would be, look at the problem the person has. If a person comes in with COPD or known history of COPD or chronic bronchitis or a history of smoking for a very long period of time with shortness of breath, and he's aged, of course, then you must think of respiratory failure type 2 and respiratory acidosis. So, to summarize, respiratory acidosis increases carbon dioxide, drops bicarb and drops your pH. Remember your 3 steps and you will not get it wrong. I'll see you in my next video, hopefully soon.